everybody. All right, so everyone's got to pack anything. Let's start off with some practice multiple choice questions. If you did not sign in, you have to have this Sheets app. So like if you don't have like the Google Sheets app, it won't let you type, I think. Yeah. Okay, so maybe a friend could sign you in if you have not yet already. So this is going away in 3, 2, and 1. Hooray. Hooray. I'll move myself here. Okay, so there's 1, 2, 3, 4, 5, 6, 7, 8 questions on the front. Clinical psychology should be not the most freshest in your mind because we did cognition most fresh. But based on the recency effect, we should probably remember most of these. So I'm going to give you like, I don't know, 10-ish minutes to work on the first page, multiple choice question. Maybe pencil might be your friend. And if you don't know, maybe like skip to the next one. And then we'll go over. First page only for right now. See, we're chunking it. Just doing it in sections. Imagine psychology is like psychology. What? Freud, yes. Is that what you're trying to say? Yeah. Words are hard. Is that the cough that we were talking about?
But I can't. No, listen.
I can't go to work.
No, listen. You.
She's sick.
I am sick.
What is convergence?
You should know that.
Oh. What did he say?
Was it already been?
Shame.
Yes.
I don't think we talked about this.
I know. Actually, we did.
What? Did we?
We did it in class. Conversion disorder?
Oh, yeah, we did. Yeah, somatic.
It's also called somatic. Where you have a physical, for no physical reason.
Yeah.
It's like,
Yeah.
Like physical,
Problem, some sort of physical problem, but the reason is psychological. Like my hands go numb because I'm having a panic attack.
Oh, it's sad. What is remission?
What?
Remission.
Where are you reading this?
the bottom left.
Fourth question to the left. It's an answer choice. A disorder.
Oh, in remission. It's like gone away. Like cancer can go in remission.
Oh.
So it's like
So
gone. It's not
disorder
active.
that's gone. Oh, and
Yeah. He didn't give me anything.
He didn't give you.
Oh,
No. Can you?
I'm scared of the.
Yeah, he told me he was, and then he never did.
Oh, okay.
Is he not in there?
I can go check.
Okay.
Just Taylor, what would an affective disorder?
Where you at?
The fifth
Hey,
question.
you try answering one of these, but
Actually, the sixth question.
Left, right,
Right?
right. 2 down, 3 down, 1 down. What?
The second one on the right.
Affective disorders?
Yeah.
Yeah, I have no idea. So then it's probably not that. Friends, would y'all like some multiple choice practice?
oh yeah.
Just to see, compare like no skills to skills.
Oh, or at least
This will show your
like level versus.
What if this is all just common sense and really your teaching degree has gone to shame?
Joke's on you. I have no degree in psychology.
So that's kind of.
I was given a textbook until you're teaching this.
You do a pretty well job. Pretty. What's the word people do? Like exemplary. Pretty exemplary.
Oh.
I thought you were gonna say adequate for a second.
Oh, it's like
Inadequate.
You're pretty crappy, John. How much more time we need?
Just another, like,
So what are we doing? What are we doing in the tutoring on May 8th, like the day right before the exam? Is that like an actual event?
I know those answers are wrong.
Are we doing it?
Okay, so
Okay.
we're doing cognition,
No, I don't.
Okay.
because it's the biggest part of the class, student analysis, and, some FRQ practice.
Okay.
So just FRQ, like, random, just like you would have the next day.
Super fun.
Uh-huh.
Wait, what was it? What are we doing? Because there's a May 8th session, and I was like, what are we doing? That?
So test is May 9th.
Yeah.
What's it go last?
So it's like, what's the last thing? Cognition, so it's fresh on the brain. And FRQ practice, which is just like, not FRQs over cognition, but just like anything, just a quick
So-
like little practice.
What we learned yesterday, what we learned on Tuesday was privacy attempts.
Well, whatever we learned first. Yeah, so we're just looking at reviews. Yes, what we learned Tuesday.
I already forgot.
Yeah, me too.
Great, we're supposed to
First
forget
is the first
later,
thing.
not now.
To like,
I don't remember. Like I
but I
remember
don't.
that's
What
what
it's
it's
called.
called.
I
I don't
don't
remember
remember what I learned.
what the like question.
I mean, I'm sure if I like looked at it again.
That's just
I would actually study less for this class than I thought I would need to. Like,
I've heard the exact opposite.
Yeah.
actually that's me.
Yeah, I've heard like, I thought this cost would be easier than
It doesn't matter how much I study, I get the same grade.
which is like a 95 anyway, so you
Oh.
Okay. Alright, ready to go with first page? Alright, before we go over it really quickly, just compare your answers to people next to you, just to see like, are we on the right track? How we feeling? What's going on?
The CBC.
So next to Nyla. Nyla's
Oh, I didn't get A.
I said,
You definitely copied it.
Wait.
At least the first one. At least
No,
the
I
first
got
one.
that one.
yeah,
Yeah.
like I don't remember.
I actually went to
Talking about what? Right.
But then three is all the way over here.
Hey, I got
You know,
it.
like, you just like mine.
No, like he actually got it
I
right.
went to.
Miss Taylor, he actually got it right.
Imagine how bad you feel when you get an answer.
Me as well.
Oh, I didn't get the point.
Me as well.
Okay, ding, 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 let's go over. Okay, according to psychoanalytic theory, yes, this is Freud. This right here, I should have capitalized his name because it's a name, but that's Freud. So the basis for development for mental disorders are, okay, what's the correct answer here? C. What is A? What theory would be A? Not, oh, actually, yeah, I was looking at the wrong one. Yes, it is behavioral.
Who is that? Skinner. Nope.
Well, yeah, Skinner, Pavlov, John B. Watson, all of those classical and operant conditioning people. Social and economic cultural factors, what perspective?
Wait,
Social cultural.
Whose people are those?
No, there's no people. What would be D?
Oh, brain, biological.
Biological.
Wait. Okay, so when it says imbalances in the brain, can you say neurobiology?
You can say neuroscience or biological,
Okay,
but
you can say
neurobiological is repetitive.
what about neurological?
Oh yeah, neurological.
Yeah.
That's what I meant.
What do you think this leads to? Like, I think it's humanistic. I think it's humanistic.
Is humanistic hierarchy?
Yes.
Okay, yeah.
That's Maslow, Carl Rogers, self-actualization, all that jazz. All right, this one over here, let's just go straight across. It says, when community psychologists refer to primary prevention, what are they trying to prevent? Like, what's the purpose? Which one? Go ahead. Okay.
Humiliated women.
I don't know what primary.
What does prevention mean?
To prevent.
To prevent, not to treat it early, but to stop it from ever happening. Which is A.
Oh, we're on that one.
Oh yeah.
I definitely
Oh,
did not
I
think
was
we're on
going
that one. I
down.
said
Oh, sorry, I went across.
You still didn't get it.
Yeah, I still did it.
Just throw it right under the bus.
Wait,
Okay.
what is it?
It's A because that's what prevention means. To stop it from happening. I'm gonna prevent your cancer by treating it after you're riddled with cancer. No.
Oh, I thought that was too easy of an answer to be right.
It's AP psychology. It's not that hard. Sorry. Okay, controversial. All right, which of the following, well, I'm on this one right here.
Okay.
Which of the following individuals would be most likely to be classified as exhibiting a social phobia? Not just phobia, but social phobia. Correct answer is?
Pretty.
Pretty. B. Okay. Snakes is not a social phobia. Unless you're hanging around snakes. Yeah, just the other ones are just not it. So there's no way to explain why those are wrong. They're just wrong. Delusional thinking is central to which of the following? What's the correct answer? Schizophrenia, but not just delusions, but also hallucinations.
Could your hallucinations like make you do good things?
If you think that you're
I guess. Remember, like in Asian cultures, their hallucinations
Oh, like little kids, right?
are like sweet and nice, and like American hallucinations are like scary and demonic. So maybe if like the little kids are like donate to the local shelter, then maybe.
Would they ever like relate that to like culture? Like would they like relate on a test? Would they put those two together?
No.
In some
No.
way?
The reason that I know that the hallucinations are different in cultures is because I read that in an article. It was not in our textbook.
I see.
So that was just me knowing stuff.
But
Yeah.
we could use that as a
They
Yeah,
have
can I
no
use
way to prove it, right?
Well, they can't prove why. But like they can prove someone's having a hallucination.
Yeah, but they can't prove like why.
Okay. All the following are anxiety disorders except, so they're all anxiety except for which one? Conversion. Okay. So agoraphobia. What's agoraphobia? Fear of?
Large spaces.
Yeah, like open, large spaces.
I got that wrong.
Me as well.
I said spiders.
PTSD is what B is talking about. That's like some sort of trauma. OCD is what C is. And panic disorder.
I'm still on that.
What is conversion?
You literally just asked this. Okay, so
Just the name just gets like
you
it's
did.
up.
You did say this.
Once one is
Sometimes so
gone, the rest are given up to.
Okay, but you also did say you said that your hands would go numb because of panic.
Oh, I was like,
So that
oh,
could
we
maybe
are having a it's like okay, so your psychological problems convert themselves into a physiological problem. That's why it's called conversion. Because it's converting one problem into something else.
I don't know why I'm using things like yay.
Oh no, I know what you're
Conversion
thinking of. You're
camps.
thinking of conversion camp.
Wait, is that where they
Because,
go?
like,
like,
They're trying to
Rainbow.
also convert one thing to another.
is that where you like go to a hospital so you go to school and you don't?
No, that was something else. Okay. All right. ECT, electroconvulsive therapy. When would you use this? Major depressive disorder. If your drugs aren't working, if your antidepressants aren't working, shock them. Okay.
Just Taylor. What if you like accidentally kill them with their shot?
It's only 80 volts. 80 to 100 volts. That's like nothing. That's like static electricity 4 or 5 times.
okay, so
Like a balloon.
jump on a trampoline if you're depressed.
Okay. That was me rubbing a balloon to get this set. Okay.
Oh,
A client whose improvement during therapy is a result of his or her expectation of improvement is what is that called? Placebo effect. There's no actual drugs in the placebo. They think they're gonna get better, so therefore they do. Hey, what is catharsis?
The feeling of like
An emotional release.
I don't know,
Like having a really good cry, or like screaming in a pillow and you like feel better.
like running.
Yeah, for some people.
For me.
What is tardive dyskinesia?
Being antipsychotic.
That facial spasms due to what? Being on which type of medicine too long? Antipsychotics.
Chlorozepam.
Oh, the actual medicine is chlorpromazine or thorazine or something. And so this is that facial spasms.
We never learned about Prozac and it was up to 10. I mean, yeah. It was,
We thought it was mentioned.
but
It was like in a parentheses in notes.
oh, okay.
I don't know if that matters.
I'll figure it
Yeah. Face spasms because can't spell schizo. Let's try that again.
out. guess.
Schizomeds. Alright, light exposure. What's wrong with you? You are sad. Remember, that is not about weather, it's about like Alaska.
Sunlight.
Sunlight.
Cactus. Flowers.
Hey, before you flip over, what's the medicine for schizophrenia? What should you be linking? Don't say antipsychotic. What is the neurotransmitter involved?
Dopamine.
Dopamine. No, that's depression. OCD doesn't have it has. They usually give anti-anxiety meds. I guess we could say anxiety. Anyway,
Wait, OCD is a panic disorder?
and OCD is an anxiety disorder.
Yeah.
Mr.
That's
The schizophrenic medicine always ends in IND.
Yeah, usually.
Z-I-N-E. Because sometimes a medicine
She said
has
that.
In the test, it was just INE. That there's two. There's
Yeah.
one zine, and then there was just one that was ine, and they're both antipsychotics.
That's okay. Wait, was that one of the answers?
Yeah, but it was wrong.
Oh. I got it. It was something. So Prozac was right.
Prozac was the right answer.
Because it was having depression.
Okay. I'll give you some time to work on the back, the rest of these multiple choice questions, and then we will go over.
So how many multiple choice you want to test?
100.
Okay, do we have like
70 minutes.
But like some of them like it's like
Some of them are so short. Remember,
Yeah.
that time we'll just roll over to the next question. Yeah. I haven't had anyone not finish the test.
Really?
Use unmarked.
Okay, well, do they just
For myself.
circle if they run out? Is that why they're not finishing? Or?
Yeah, like you don't leave anything blank.
So when you're like out of time, they just circle.
Yes. Or bubble. Yeah, because they used to count off for wrong answers.
No, they don't.
Now they don't.
Oh.
So like if you get a right answer, it's +1. But if you get a wrong answer, it's just +0. But it used to be like -1. But now it's just so like that's why like you don't leave anything blank ever. You just put the C or whatever. But you put the same answer for every guess. You put the same answer. You don't skip around ever.
Okay.
Yeah. Math. Statistics. Okay, we good? Can we go over? First, share with a friend. What'd you put? Compare.
Oh, for 4, I think.
Yeah, I did too.
For 4.
For 3, I got A.
What did you guys prefer this one?
Obsessive. Compulsion to behavior.
Okay, let's go over. Dora. Dora alternates between periods of extreme euphoria. She's talkative, everyone is excited, and then she has sadness and hopelessness. What is she? She's bipolar. She's got mania and depression. So this whole very talkative, hyperactive, that is what mania looks like. Okay? All right. Let's do the one off to the side here. The role of the therapist of cognitive behavior therapy. This is it. I just added the word behavior. Sorry, cognitive therapy. So when you see the word cognition, what words are going to jump out to you? No, not cognitive. Did I say behavioral?
You did say behavioral.
I'm sorry. Yes, you would have been right. That's not the question I should have asked though. What is the word that should pop out for cognitive? Thinking, thoughts, memories, whatever. So what's the correct answer here? A. Irrational beliefs, thinking, alternative ways of believing. Which perspective is B? Humanistic. Well, what is C? That's Freud. What's Freud? Psychoanalytic or dynamic?
What's insight therapy?
Where are we looking at?
No, just asking a question. Insight therapy.
It's like an insight means an aha moment. So just I would say, where are you seeing this word anywhere?
No, I thought it was. I was gonna say insight therapy.
Oh,
Because on the Quizlet, it's like you're looking at the hidden.
dreams though, and resistance and transference are all psych. Obviously, they're all Freud terms.
Okay.
Yeah, psycho and humanistic is also D, and then biological. What?
I thought Z was big.
Oh, I just saw the word positive. I didn't even read it. Yeah. Oh my God. Okay, you're right. This is what happens when you skim. Yeah, it is behavioral because it has the word reinforce. I just saw the word positive, and I just now you just pay attention. Okay, so let's move to the next part. Yeah, I have a feeling that we might have some disagreement about this next one. Maybe. Not bias, just disagreement. An individual that has reoccurring, all the time, unwanted thoughts about doing harm to his family. What do we think?
I really thought it was A.
I said it was.
What's somatic form disorder?
That's the same thing as conversion disorder.
Oh, okay.
You're still here?
I'm still there.
Okay. All right. It is C. Sorry, I can't. It is E. It is E.
But where were the actions?
There are no actions. He has obsessions. He has unwanted thoughts, reoccurring. He's obsessed.
The marks. The little thing. Is that and or?
Yeah.
And or compulsive.
It's usually both. But it's not the other four.
See, it's the other four.
It's not. Oh, it can't have I can't pay attention in class, so it's not C. PTSD is he has flashbacks. It's not B. Dissociative identity disorder is multiple personality disorder. So that's there's no where it doesn't say anything about I believe I'm a different person. No, and it's not conversion disorder, so it's not D.
Wait, obsessing over something unwanted.
No, just the fact that it's recurring thoughts.
So
It
it
could
got
be-
to do with unwanted.
I mean, OCD is a disorder, so it's probably not like, I'm the best, I'm the best, I'm the best. But it's probably like, I'm terrible, I'm the worst, no one loves me. That type, probably that. Okay. When Betty lost a job, she kept returning to work each morning because she did not remember she had been fired. She saw a doctor who found no brain injury or other neurological condition. Why is she forgetting? What's the answer? Dissociative amnesia. Because she can't remember, and there's no physical reason. Hey, speaking of amnesia, what if it's I actually hit my head and I can't remember new memories? I can't make new memories. Anterior grade. What if I can't remember the past? Okay, George skipped school. Repeated acts of vandalism, petty theft. What is he?
Oh, I said oppositional divide.
No.
I didn't know. Yeah.
I put borderline.
Oh, that's not as good.
And it was like that's like impulsive.
No, it's antisocial.
No, it doesn't have anything.
Who read Devil in the White City?
Me.
Really next door.
Oh, it's DK.
Okay.
He did some freaky things.
It's
Did he do any fraud and like steal things that weren't his? Devil in the White City?
Okay, he
Was he a
might
psychopath? Was he a serial killer? Antisocial personality disorder. Little empathy, which is why they can commit fraud and take things because they have zero feelings of empathy.
And killed
Does
people
oppositional
apparently and
divide
stuffed them in
start
freezers.
Does opposition divide just a real thing?
Yeah, it is. As a teacher, it is a real thing.
But is it a real thing?
Is it like college board reading to know real thing?
Okay, do you know what it is?
No.
It's
Okay.
you just define it.
Like you will not follow rules
Ooh.
just because they're rules.
skipping
So, like,
school and that's giving us.
What's it called?
Yeah.
What's
Yeah.
Where does it say rules?
Conventionalism.
If someone had said like,
Conventional mortality.
It's like the
pre-conventional.
You're supposed to know school. You go to
Yeah, but they lack.
They lack conventional.
so this would be like
That's breaking the rules.
students, like there are students in this building that have oppositional defiant disorder. So like, okay, so we're not gonna wear hats in the hall. Where does it have in the hall?
So again,
We are gonna
reverse
shave our face.
psychology,
Go, where's a beard?
But we
Oh, I'm
have-
not,
Do you
I'm
give them
not
like
gonna.
do you give them like leniency because like they
Yeah, because they have a disorder, we cannot, like, those kids that have oppositional defiant disorder, if they break the rules, they cannot be held accountable.
So can you just say you
Public
have
to
that?
public.
Wait,
Wow,
so
but
can
You
just
have to be
reverse?
diagnosed, obviously, there has to be paperwork.
what if like
What if you just like
it's a
big
teacher,
picture?
like you see a teacher in the hallway and like you know you've learned this.
Yeah.
And like you know for a fact you don't have it, but you, like, the teacher just tells you like, hey, take off your hat. I'd be like, oh, I have this, and then you just walk away.
Exactly.
Because they can't, they're not gonna like go to the AP and be like, this is
Which is why teachers rarely will say everything to the people that they don't know, because it's just not worth the hassle.
Taylor,
Wow.
can you reverse psychology though? Like
perhaps.
say like it's a rule.
Oh, yeah, you should wear a hat, keep it on. I don't know, I don't, yeah, only the, you know, the losers have ID on. Wait, I thought that worked. No, I don't know.
I don't think
That would work.
How do you not know he's like not telling his mom? He's like, yeah, I'm gonna go to school, mom, and he skips school.
It just tells us.
Where does it say that?
No, I'm saying like, how do
Don't
we know?
assume. You know what happens when you assume?
Oh,
Curiosity
no.
kills a cat. Is that what you're asking?
No,
She's
you make an ass of you and me.
Oh.
Because you assume.
Oh.
She's using confirmation bias.
It's how you spell assume.
Yeah, I
Okay.
got that.
I'm glad the people that watch this video are like,
No one watches these videos. They have 0 views. Okay.
Wait, really?
Do you actually?
Oh, it's alive?
No, it's
That would make no sense.
Don't forget to smash that like button, click the bell for notifications, and leave a comment below.
No one should
Okay.
Don't forget to like, comment,
If you want all cool videos, go to Patreon and see me on Twitch. Alright. Dr. Nora puts a cat. It's flooding. It's flooding. Hey, you can't leave. He's flooded with cats.
Oh, we're done.
No.
Yes.
Look
no
at
way.
Yes.
Yes.
He did this last time too. Jack,
Okay, last time I did, this time I actually want to do it.
There's questions on the back.
Jack, that sounds
Jack.
Oh yeah, we don't do choice questions. We still have 3 more.
Hey, can we do
Wait,
the
Jack, we
voices?
don't even write
We're doing
them.
that right now.
Jack, we just talked through them.
Jack.
That's the problem.
Jack, we just talked through them.
He doesn't do that.
Where do you go? We talked through them.
Hey, let him live. Let him live.
Why is he getting
I don't
up?
want any party poopers in here.
No, they'll stay.
Take a
No,
hike.
no,
Oh, he's sitting down, backpack on.
Okay.
Any more discussions that you'll leave?
Reverse psychology.
We did it. Cubes just now. Yay. All right, let's do those 3 little questions on the back, and then we'll do FR Cubes. There are 3 questions on the back.
S's are always exact. Nope. Where are you? I'm a local. Skip it.
Is the first one on the back talking about how they go like this?
Yeah,
this,
EMDR.
Yeah, they're like, I'm gonna get this out of your head.
Yeah, and like this. Okay,
I remember you tried to do that meet and it just didn't work.
I'm not a therapist.
No, it didn't.
I know you
because
said like there's a kid who like got it done, but isn't that what if it's like placebo effect?
The
They're like,
guy who
I think
his
I'm getting
best friend-
better.
But then isn't that like okay still?
I don't know.
If you get better, it doesn't matter if it's real or not.
But what if
That
they didn't get
sounds
better?
bad.
It worked for me. I had to do it
You can
like
see your
for
major.
therapy, and then like it was like
Never mind.
Yeah.
I've been convinced.
There we go.
You're welcome.
But yes,
You're
that's
welcome,
what
Miss Taylor.
Okay.
So it's asking for something that's okay. Got it.
Yeah, it's a not question.
Miss Taylor, on the test, why was it the one that starts with a V?
One of what?
The like,
No matter.
yeah, why wasn't that one? It was something else.
Valium is an anxiety med. The question was talking about antidepressant.
Oh,
Are they not basically the same thing? No.
No. Yeah, you mix them together.
I don't
so you
get
know.
this first question.
Yeah,
Everyone's
it's like
asking.
brain teaser.
It's like a brain. Which
It's
the
a
podcast
brain.
Okay, do you want to do it together?
Yes,
Yeah.
please.
Well, I was gonna ask like to reword it.
Okay, which of the following is not part of EMDR? So EMDR.
She said something about CI.
It's iron. You can quite. It's seen, but like it's also mean.
Can you kick this guy out?
He's your friend. You brought him here.
Unwilling.
Get here, you said.
Attentions.
Do we have an answer for the first one?
Not a confident.
Or C. Or C.
I'm stuck between these.
I think
A.
Steve's.
I was between A and D.
Okay.
Hey.
Which one
Steve.
is not part of the treatment?
D.
Yeah,
That's insanity.
Okay, so
It's
what if
not
this is
part
like
of
a
the
trash
because
environment?
what if it's placebo?
Okay, so do they talk about traumatic events?
Yes.
Yes. Are there eye movements?
Yes.
Could it be just the placebo effect? Yes. Remember how the title of that slide was pseudotherapies, meaning fake maybe treatments.
So then why is D wrong? Because it's
Because that's not part of it, because the other ones are right.
Gotcha.
You got it right away.
Okay, hey, which one is an SSRI? Now we know it. Which one is schizophrenia? Thorazine.
Lithium is bipolar.
Lithium is bipolar.
From the guy
And
that's
Prozac is depression. Xanax is anxiety. Valium is anxiety.
Wait, so
Oh wow.
Well, these are all drugs. Serotonin is neurotransmitter.
what? I don't know.
Oh, so Prozac,
Are you not
you're depressed. You're not absorbing your serotonin.
Okay, so it is for depression.
It is with depression.
Because I drove
Yeah.
today.
So if you're depressed, you don't have serotonin.
You don't, or you're not absorbing your serotonin. So Prozac is going to be a blocker for reuptake. So you're forced to absorb what you're making.
Okay.
Flip side.
She doesn't
Have a good week.
thing.
No, I don't get it.
Hey, everyone's favorite. Boys.
Oh my
That's
god.
all.
Girl empowerment. Where did you?
He said he couldn't come today.
Oh.
He said he couldn't come. All right.
She was like, okay, ladies, thank you so much. And she's like, and Jay.
Yeah. Go shake his head in the back.
Oh, maybe he's watching the video right now.
In the live.
It's not live.
No, but like
Okay.
later.
Why would it be live?
Because she was talking.
I used to do it live.
I
But
think
then
that's
why
a good
would they?
idea.
Why would they?
Why
not
would
let
they
you
Yeah,
not
guys
why
come
wouldn't they
here and
come?
watch it live?
Oh,
is this during COVID?
No.
Oh.
They would
Yeah,
watch
that
it at
would make
home.
sense. Okay. So we're going to talk about it and then write the correct answers, but I don't want y'all to like start writing things and then like, well, that's actually wrong, and then now you have something that's in your
Do you have
head
to write
that's
a
wrong.
pen
What?
for the FRQs? Do you have to write a pen?
Yes,
Oh, like we do.
like
Same
we do.
question.
We've done only like 2 FRQs.
It's like that for every.
Yeah.
I mean,
But
I
like,
like it.
but this is it. This is like we're doing it now.
Wait, is the mock one have an FRQ on it?
No.
Oh, thank God.
Yeah. Could you?
but
you hold the
FRQ is
pencil.
like just FRQ is just knowledge. It's
Do
not
you
like
get-
you have to
I just
like
don't like
literally-
writing.
Yeah.
Do you like
You should choose
enjoy
a purpose.
seeing the wheels
Yeah, I
spin
don't
and like
like
some
the
people?
wheels
Do you ever see like the
spin.
reaction in someone's eyes? Like they're like this. They're like,
No, please, you choose.
No.
Yeah,
No.
you
Just
should
tell
choose-
us-
but
tell us
don't
if
use
I'll
a
be
wheel.
biased and I don't. I'll be like, oh, I like that.
Like-
They could go together.
Yeah,
the
that's
lowest-
exact- no,
No.
like if
You
someone
know,
gets
As long as I don't
if
get.
someone gets stuck with like David,
But then-
Dad,
Honest, it's unfair.
it's
Okay.
really it is.
Wait, I'm pretty sure
Oh,
David
by
Fair
definition, because it's the wheel, by
It
definition,
is
is fair.
Yeah, but what if
So
they're
that's
weird?
Because everyone
Take
knows.
them out.
I don't
Take
know
them out.
What?
Take them out of the wheel.
I will.
Take them out of
Put
the
him in like
wheel.
with William.
Yeah.
No,
that's
Please,
what
William
he was
was
William.
actually.
Please be
Oh,
William will
I
just
want
do
him
it
to be
himself.
William.
I feel like he should.
Oh,
right.
All right,
What if
so
I just did it?
let's talk about biological first.
She said it.
Said it again.
She just said it again.
No one watches it.
They know the word.
I watch it.
Okay, Jerry suffering from major depressive disorder. Discuss the basic emphasis of the following perspectives. Then describe how they would explain the cause of depression and treatment for depression.
Oh.
Okay,
Okay.
so let's do biological first. Causes and treatment. Causes of depression, treatment of depression. So what I'm gonna do, I'm gonna do this.
Yeah. But it's definitely.
I think so.
I don't know. What else?
Well, I was just thinking genetically.
I'm not gonna
you can't
answer.
look. It's like my mom's question. I am too.
Wait, what's the part that does your emotions in your brain?
Got it?
The
Humanistic.
No, she's talking about the physical
Brain.
part.
Oh, the car. The
What?
the amygdala.
the amygdala. No.
Amygdala. Amygdala.
Because
I
I remember
wasn't
like
here on
Amy is
that
like
day when we
crying
did all
or
this.
Yes,
you said-
Amy, she's just so emotional about Amy.
Yeah.
Amy.
So then they would have problems with
Gala.
her.
Amygdala.
That's
It's amygdala.
That's what I was trying to say. I was like Amy.
Amygdala. Okay, so for the biological approach, what are the causes? What are the causes of depression?
Genetics.
Okay, genetics.
Biological.
Are there any other things that you could have said?
Can you say drug abuse?
No,
Alcoholism?
no.
But why? That's biological.
But like, okay, what the heck? Ah!
But it's still in your body. Where else would alcoholism go? Oh, behavioral.
Okay, hold on. We're still biological. Are there any, I don't know, hormones or neurotransmitters associated with depression? Serotonin. How, too little or too much?
Too little.
Too little serotonin.
I think in this
And norepinephrine.
Yeah.
Oh,
No, rhine,
I did
repine,
that.
frin. No epinephrine, lack of it. Okay, what about treatment? How do you treat it?
Drugs.
Specifically?
Prozac.
Less specifically?
Antidepressant.
React antagonists.
SSRI.
SSRIs.
Oh.
Or you could say Prozac. I want to say drugs.
Drug therapy.
Methane. Okay.
Wait, what did I say?
New
for a
drugs.
second?
SSRI.
Would it, so to get like full points, would you have to say like SSRI because like okay,
So it's like
But
just
you-
identify.
You can't bullet point, like you can't do this.
right?
You would have to say, according to the biological perspective, the cause of major depressive disorder might be due to a lack of serotonin, so they will treat it with drug therapy, possibly using SSRIs.
Is there any words
Period.
that like we shouldn't use on our FRQ? Like
I think that was
Like shortened, like
Like
Well,
etc.
Yeah,
Like ETC.
My W slash.
yeah, probably none of those.
Can I use my
Oh,
and symbol?
Yeah, you can probably use an answer.
Wait, it's
Okay.
on paper, right?
Yes.
No way, I agree.
Nope. So, I mean, whatever. Now, trait perspective. Cause,
Oh,
not for
development.
trait.
Like human development, like
Okay.
parent childhood.
So, like, even if you disagree with it, you have to be using, like, the big words for the trait perspective. Like, big terminology. Do you remember anything to do with trait perspective?
You say the first letter of the word that you're thinking. The first letter of the
The
word
first
that
letter
you
of the
want
answer.
us to say. The first letter of the answer.
I wrote like 5 things here.
Okay, just one of them.
Okay. P.
Personality.
Yes. Characteristics. Okay.
I'm like
Woo!
5 on the AP test. Or my own word.
Personality. Can you give me more specific? Like, maybe they're not an E, but maybe they're an I.
Introvert.
Maybe they're an introvert, and so they are not around people, and maybe the lack of people.
Social personality
So,
disorder.
Environment too then?
No, trait perspectives are not going to be about the environment.
So trait is like internal.
Yeah, it is like your personality traits that you have all the time. That you have all the,
Personality.
yes, but not the trait. Trait perspective does not believe that. So introvert.
Yes, and
You could talk about ocean. I mean that.
Oh my god. I got excited about that.
For ocean?
Oh my god, what am I doing?
No, that movie was cool.
You can remember talk about type A, type B. Like you just have to pull things out of your butt that are trait perspective terms, and just apply them. They're not asking you like, is this real? They're asking you, do you know the trait perspective terms? That's what it is. What about treatment?
Oh, there's none.
Wait, therapy.
For
Therapy.
personality?
Yeah.
If you're like a bad person.
Okay,
Like you What can't do about
anything.
environment
Except
for like a treatment? Like we put them with
You
a
go to
bunch
ther-
of people who are
Therapy?
people
Different
of personality, don't you like adapt to that?
group therapy.
no, it's or like what are they called? What are they called? Where it's like a insane asylum. Because like type or like the ocean thing. Like if you're like a psycho.
Okay,
person,
wait, I'm
You
thinking
can
if
go.
you're depressed and you're like,
But this
But that's
and
not.
that's just like who you are. Like, what
this
would
is
I do to help you?
Yeah,
if you can't
you can't just be depressed. That's who you
What if you
are.
put them with happy people?
There's
Would they
something
be
that causes the
unhappy?
depression.
I mean, I don't hate the idea of group therapy.
Why not?
Well, it's an SAT. I mean, what's it called?
You don't like it?
No, I don't hate the idea of that.
Oh,
She likes it.
I thought you said that you. I was confused. Cause it's like you're running from others. Like you're like, hey, like they
Like
they
you
like
are
to do
never
this
by
to
nature
you.
by forcing you to be with people through group therapy.
I
That's
was
what I'm
thinking like, hey, we're both introverts, but like he gardens. Maybe I should try gardening to help.
Oh, that's okay.
She's a
Okay, I'm erasing this and
That's
this.
only treatment.
That's so reinforcing.
What'd you have written down?
I had nothing written down.
Oh.
I literally put like last year when I did this, I put like treatment, nothing.
That's
Nothing.
not sad.
Then you can fill it
You
in.
just looked at me.
I won't need this next year.
Oh.
Okay.
Pass it on.
Oh no! If I had to make everything from
Well, no.
scratch, they had to too.
Did you study psychology?
No.
Where did you study?
Economics.
For a minor in psychology?
Nope.
Wait, so then how do you
How are
know
you-
psychology?
How are you here?
Because I have a composite social
She
studies
does what she
degree.
wants.
Or
She gets what
certification. So I can
Oh.
teach
She went to the
anything
Psych
by law
history.
in social studies from 8 to 12. 8 through 12.
You went here.
Yeah, so
You
she-
went to Tom
Scott,
Miss
did you know Scott?
Miss Taylor,
Where am I?
what
Wait, what? Shut up.
what year did you graduate?
She said, but hey.
Shut up. We're in the same class as Scotty.
Great.
Or no, I don't
Oh yeah, when
did
did
Scott-
Scott?
what's her maiden
Scotty
name?
told
Leo.
When did Scott?
Liam?
Leo.
Leon.
Mr. T.
What's her first name?
Jessica.
Jessica Leone. Sierra Leone.
Sierra Leone. That's what you're thinking of.
Graduated
Great question.
Wait, how old are you?
Miss Taylor.
She just
You were in a.
You're so young. Why are you?
No, yeah, she graduated in 02.
Yeah, she was like
02, yeah.
I would say that loud and proud.
Yeah, that's like.
I say that. It feels
That's
good.
the other time you do that.
Wait,
Uh-huh.
so funny. Wait, were you in the same class as Scotty?
He graduated like he's older. His kids are in college. My kids are
I thought he was a kid. I thought his youngest was in high school.
He's older than me.
I thought his youngest graduated with my brother.
Yes. But
Yeah,
his
but
oldest
now
one
he's-
just graduated from
Wait,
A&M.
so did you
Oh,
like see him
that's
at
the one that's
Pride,
so-
Texas?
No,
You know, he lives in
graduated like
Mr. Greer
97.
can't been here since.
He
my
has the
grade
same
year.
truck for like so long. He has this one truck that I see everywhere in the neighborhood. He lives in Creekside.
Oh yeah, because I remember I saw him.
Psychoanalytic perspective.
Sorry.
Okay. What's wrong with you?
Trauma.
And I saw Mr. Scott.
No.
Unconscious.
Unconscious. Something.
What?
Sexual
How
drive.
does wait?
Unconscious. It's psychoanalytic. It's Freud. So you gotta
Yeah.
talk about subconscious, maybe denial. You can use these. Ooh, I can't spell. Denial. Defense mechanisms. You can talk about id, ego, super ego.
The stages of grief.
No.
But would it
No.
make you sad?
Maybe. As long as you
Maybe
can talk
it's-
about it.
Can you finesse your way through this?
Oh,
that's-
100%.
Yeah, for sure.
Yeah.
You just realize, you're like, I literally got the answer right because I watched a YouTube video, a Shane Dawson YouTube video talking about Xanax. That's like the only reason I knew that was the right answer. It's so
Oh,
sad.
you can talk about because this neo-Freudian. Do you remember?
Yes.
Nope. Do I remember? Who came up with? Oh, Alfred Adler. He came up with
Yes.
inferiority complexes.
Yes.
Okay.
Just
Okay.
kidding.
So that could also be causes inferiority complex. You feel inferior to your peers because maybe you're a middle child or something. Because that remember he talked about birth order, Alfred Adler. He was a neo-Freudian, so you could talk about him. You probably won't. You'll stick with Freud. But how do you treat it? What was his treatment techniques? Dream analysis.
Free association.
Yes. Free association.
Right.
Writing.
That's writing or talking.
What was the therapist having a crush on your therapist?
That was
That was the Sopranos.
It sounds
Yes.
that, right?
Yes. That was transference, but that would not be like the treatment would not be to have a crush on your therapist. That just might happen through treatment. But he might actually do. Do you remember Rorschach inkblot tests
Yes.
or the thematic apperception test where you tell a story to the picture, or draw a person or sentence completion? Does this mean right?
Yes, I
Okay.
remember.
It's ringing.
It's ringing.
What about hypnosis?
Perfect. Yes, hypnosis.
She's spitting out.
Bella, so proud of you and your little.
Bella, you
playful
didn't
hand.
even want to come. Look at this.
I know. Okay, let's do behavioral now.
Okay. Behavioral is environment.
Yes, because what is his word mean?
Upward.
Well,
Operant conditioning.
and
Classical.
so all conditioning, right? So you can talk about operant conditioning,
Reinforcement is that here?
classical conditioning, reinforcement, punishment. Don't forget about the Bobo Dog guy, because that was learning too. Albert Bandura, and what did he call his type of learning?
Learned.
Learn.
Oh God.
Learn helplessness.
Saying learning as a retrieval cue.
Is it learn helplessness?
No.
Social learning or modeling?
Oh,
Modeling.
modeling.
Observation,
You
modeling?
said learning, so I was
I
like,
meant-
she's on the right track.
I knew it.
Learn. Someone hit her upside the head. Okay, how do you treat it?
Client-centered
No
therapy.
crap.
That's
what-
humanistic.
Not client centered.
Reinforcement.
Okay, do you
Oh, token economy.
Therapy.
Token economy.
token economy?
Bro. At first in therapy, Lily said.
Yes.
Right.
Because that's counter
Wait, I
conditioning,
know I
right?
just learned it. What's token?
You get a token for every time
Oh,
that you say one nice thing about yourself. Token. You can
Oh,
use these
what
tokens
was
to
that
buy a dog.
What was that thing that you were like telling Bella that she was like ugly, and then she was like, and you were like,
Yes.
What is that?
So, yeah, I went too hard, I think.
No.
Oh, on the nose thing?
Yeah.
Oh, the annoying. Oh, yeah.
Yeah.
The annoying thing. I don't think so.
She wanted to like cry.
Yeah, she's like, I'm okay. That is called rational emotive therapy. But that
Rabbit.
but that goes along with the cognitive approach.
Okay.
Not the cognitive approach is not here. Okay. But you could say cognitive behavior therapy, because we're still talking about behavior therapy. Cognitive behavior therapy. Okay, and let's talk about humanistic perspective. Carl Rogers. And humanistic? Maslow.
I forgot.
Uh-oh.
Hierarchy of needs.
Okay.
Oh yeah, you know I actually learned about that in marketing.
Huh.
Before I had this.
So was it like, what was the one that they emphasized? Like, doesn't say.
I don't know.
Okay. What are the causes of your depression if you believe in this perspective?
You're not self-actualized.
You are not self-actualized. But also, what are you probably not? What's the one right below self-actualization?
So self-esteem.
Yeah, you probably have low self-esteem.
From your environment.
Environment would
Your
be-
environment.
Yes,
Oh, but
but
it's
that's
cognitive.
behavioral.
No, but I'm saying you can get. Okay, never mind.
Okay, how do you fix it? How do you treat it? You remember what the humanistics call their type of therapy? You're not sick. You're a client. Client-centered therapy.
Oh, positive, unconditional positive regard.
Yes. Unconditional positive regard and active listening. Do you know that term?
Yeah.
It's like repeating.
Yes.
Your hand, wait, Randy looks very nice today.
Actually, it does look.
So you-
It's the pen. It's the pen.
I was being serious.
Okay. You guys-
Someone wants to go.
I was being
Someone
so
hasn't peed in like 5 hours. Okay.
Exactly.
All right. Let's.
So genuine about that too.
It didn't sound like it, but I'll take it. I'll take it. Is it over?
Is it over? Go
Run!
All right.
Go to the left. The left one.
She like ran out Okay. Often misunderstood, schizophrenia is a psychological disorder affecting 1% of the population. In addition to treating the disorder, psychologists work to identify its nature and origins. A. Identify 2 symptoms used to diagnose schizophrenia.
They can be hallucinations and delusions.
Yes,
Positive-
hallucinations and
Positive,
delusions.
negative symptoms. Negative.
That's too vague.
Wow. Okay, so
They
you can say
getting-
apathy.
We gotta do it quick.
Oh,
Yeah.
the lack of apathy.
Hallucinations, delusions.
Doing it again.
I'm
trying to think of. I was trying to think of
Oh,
positive.
look, word salad.
word salad.
Listen, I can like see the notes in my head. Right?
Me too.
Flat affect.
That's
Oh,
what
yeah.
I always.
Waxy
Robots.
flexibility.
That's
Catatonic.
Cortonic.
Yeah, catatonic. Okay. What is one research finding that supports a genetic basis? The fact that it's genetic.
That
Your parents have
family,
it.
if your family has it, you
Okay. So
genetics.
I'm gonna say twin studies because like if you really want to show like genetics, it's like oh look at the twins. You have like one schizophrenic twin, you're gonna have another schizophrenic twin.
Do you have to say identical?
So you can say no, you can say family / twin studies. Where it's right, you can yeah. I don't know what I kept on writing there. That wasn't right. Okay, C. What's the dopamine hypothesis regarding the origins of schizophrenia?
You have too much.
You have too much dopamine. And we're gonna finish this before she gets back. Describe how medications used to treat schizophrenia affect the action of neurotransmitters at the synapse.
It
Block
blocks.
reuptake.
What is it called if it blocks?
Antagonist.
It's an antagonist. So,
Antagonist.
no, it doesn't block reuptake, it just blocks it.
It's an inhibitor.
It's a.
I thought it was a
Oh, my
reuptake
finger was
inhibitor.
bleeding.
Oh, that's SRI.
Yeah, because like you have too much of it, so they don't want you to absorb more of it, they want you to absorb less of it. So it's going to be a dopamine, ooh, hello, dopamine blocker, which is an antagonist.
Yeah. We lost
I'm forcing you to be here. But I love that we're almost done. We're almost done. I'm gonna put E over here
This is
somewhere.
never going to 4. I mean 4:30.
Thank God.
Yeah, we're not. Okay, I mean we can just like sit and like read to the hair and like have a pillow
Chit
fight.
chat.
Okay. Talk about boys. Identify a risk using these medications to treat. What is the risk if you take too many of these medicines?
Tardive
Tardive dyskinesia. Oh God, am I gonna be able to write that?
It's okay, just make it.
Was that
Yeah.
Yes.
I don't remember that.
It was an answer.
I realized that if you study hard for the vocab quiz, you don't have to study for the test at all.
Almost like I put the vocab quiz right before the test to get you already started.
Oh.
Yeah, I did not do the
Wow.
I will say 216 terms.
I'm
So
sorry. I'm the one that makes the content. You're right. Okay. F.
Sometimes I do better on the vocab quizzes than the test.
Well, the
I
vocab
do the
quizzes are
exact same.
easier because there's just like
Yeah, because
No,
you
that's
can be like, Sally
I
does
missed the
this,
old
and then she
ones.
does this,
The
and
old
then
ones were so much easier.
what is she?
The
It's
old
the
ones are
situational that
straight.
really get me. Basically, all the time. I am. Something's. I'm fine.
That's the time to go home.
some people confuse schizophrenia and dissociative identity disorder. Identify 2 characteristics that differentiate DID from schizophrenia.
One of them,
Multiple
amnesia.
personalities.
That,
Amnesia.
like, you get DID from childhood trauma.
Trauma. You don't get
schizophrenia.
schizophrenia from trauma. It's biological. Also, another difference is that DID has split personalities, or like more than one personalities.
While schizophrenia sometimes don't know who they are. Like they don't.
Well, yeah, they have one personality.
Would you say
Wait, what
amnesia?
was the first thing for
You can say
Like
amnesia.
the typical, like not typical.
I'm saying biological. Schizophrenia is biological and one personality.
Yeah, you can say memory loss.
Yeah, schizophrenia is biological and one personality.
Yeah, and then trauma and split personality.
Okay.
And we're done.
Cha-ching. And
So about the partners.
Wait,
No.
pause the video. Bye, guys. See you next time.
Bye. We're all leaving now. Bye.